Hey everyone, happy Wednesday. It's Earth Day. We also have been celebrating our administrative assistants. It's their day today. And with that, we're going to start with the stats and then introduce you to the people behind me. Lee?
Hello, today was a good day. We only had one new positive, so we're happy about that. It does fit with the trend that we're seeing downward, so we feel good about that. Hopefully that'll continue. I did want to share another interesting stat with you guys today, looking at our numbers locally that sort of mirror the state numbers, and that is that there's a misconception that people that are older are the only ones that get this or have problems with it. The reality is people in the age group from 40 to 59, 42% more likely to get this than other age categories. So that's the largest category of people who come back positive. So they get it. The problem is this other statistic, people age 60 to 79 are 520% more likely than that first group to die from it. And that's because what happens is a lot of those people over 60 have more profound, what we call comorbidities, things like cardiac problems, things like hypertension, things like diabetes and obesity. Those are the top four, not just in our state, but that we also see locally that cause people to have a bigger problem from this. So again, just trying to educate people out there about this and why it's important to understand how it affects people. We continue to preach our message of do not give this to a person in that age 60 to 79 age category.
Also, having low positive number days doesn't mean the war's over. We still have another phase of reopening our economy and getting back to work. And that's why we have our law enforcement agencies and first responders and also Singing River Campus Police with us today.
We do, and we had a great meeting this morning, a collaborative meeting with all law enforcement from every city and the sheriff and others. Earl Etheridge was also involved. It was a good meeting where we talked about different things and how the community has come together. And today we've got Lauren St. Pay here. He's the administrator for the hospital here in Pascagoula. All of the service lines, all of the ologies report up to him. But also he has some areas that are administrative throughout the system, such as campus police, and our chief, Randy Sanders, reports up to him too. But why don't you guys tell us a little bit about that collaborative meeting?
Yeah, so the collaborative meeting is something we've been doing for actually a couple of years now. We do it about every 6 months. But caring communication is key, is one of our core values here at Singing River. And I think more important, having that open communication with our first responders and with our law enforcement agencies is absolutely critical in normal times, but even more so important dealing with the pandemic like we have right now.
Yeah, and caring and communication is key. And one thing that we're very proud of with our police department here is our relationship that we have with the other agencies, first responders and law enforcement agencies within Jackson County. And we're proud of the fact that we have a great communication with each one of those agencies. Part of our meeting this morning that we had Pascagoula Police Department representative, Goshen Police Department, Moss Point, Ocean Springs. We had the Sheriff's Department was part of that meeting. So that's one thing that we're very proud of is the working relationship that we have with each one of those agencies. So this collaborative meeting that we try to have pretty frequently allows us to continue that communication effort with those agencies, and we share information that is important with us and with the community as well.
So Randy, how does having one of the only police departments associated with a hospital in the state of Mississippi help you, and how does that differentiate us from other health systems having that? How does that help you with your relationships with those other agencies out here in the community?
So I'm glad you asked, and again, that's part of the communication. We're proud of the fact that we're one of only 3 hospitals in the state that has an accredited police department. So that is something we're very proud of that we've been able to accomplish. We want to be first in everything. So we're also the first of those 3 police departments in the state to have our own canine program.
You're not first, you're last.
It's not first, you're last. And we're proud of that. We've got our canine team, which we'll talk a little bit about some things with Jester, our canine, here shortly. But with our department, our experience, we've got in excess of 400 years of combined law enforcement experience with the group of guys that we have here. We're real proud of what we've been able to accomplish. But just that experience in itself and our working relationship that we have with the other agencies is key in what we do. And I think that sets us apart from other agencies, other departments, other hospitals that don't have what we have. We're proud of that.
Absolutely. And so throughout this pandemic, obviously we've been communicating all the guidelines and protocols that have been out there on the health care front. But what other activities have you been training with them and also helping with Earl Etheridge with the county? I know he's been very much involved in some of the activities going out in the field.
Yeah, so part of what we're trying to do is in collaboration with the other agencies, the law enforcement agencies and our first responders, is to be able to communicate with the public and provide education to the public. So what we want to do is educate our individuals within the community, just things to be aware of, just things that they might not think about, isolation guidelines. If you have symptoms, a number that you can call to speak with someone on the other end of the phone to help guide you in what you need to do. 809-5044. If you have symptoms, stay home. If you have a cough, stay home. But if you have to be out in the public and you have a cough, proper ways to cover your cough, proper hand washing techniques, just things like that our collaboration with first responders and the other law enforcement agencies in the county, we're trying to share that information with the community.
One of the things you guys talked about this morning was the de-escalation, sort of a refresher on what we call de-escalation.
Absolutely. Another thing, as part of our continuing collaboration and communication with the other law enforcement agencies, we're trying to plan ahead, as we're planning for the resurgence. And we know that times are getting tough and individuals have been out of work for some time now. And being in quarantine in itself can sometimes create issues where temper seems to flare, temper seems to rise where normally they wouldn't. So what we're trying to do is just help facilitate with the other law enforcement agencies in the county, kind of a refresher on how to deal with situations, how to de-escalate situations in a way that hopefully that you can handle those situations without physical altercations. So what we've done is we facilitated a de-escalation training that we're going to share with all the agencies in the county that will help prepare them for things like that.
And that's important because in the health system, we actually support a reopening. The sooner we can reopen, the better. That's why it's so important for people to be compliant with the requirements, because the sooner we can get back to get the economy going again, the better off we are, because if it continues like this, people are going to be in worse and worse situations. We're going to have problems where tempers flare and people become desperate. So we've got to get back open again. The best way you all can help with that is to help comply with those requests to avoid social gatherings. Do the right thing. That's what we're asking. So thank you guys for
And isn't there a law that goes hand in hand with that?
There is. 4123-5.
4123-5, and actually I have a copy of that. If you want me to read that, I'd be glad to read it.
Yes.
I have it with me.
Please.
Just in case I have the opportunity. So, as we said, this is code 4123-5. Basically what it says is the State Department of Health shall have the authority to investigate and control the causes of an epidemic, infectious disease, or other illnesses affecting public health, including the authority to establish, maintain, and enforce isolation and quarantine, and in pursuance thereof, to exercise such physical control over property and individuals as the department may find necessary for the protection of public health. The State Department of Health is further authorized and empowered to require the temporary detainment of individuals for disease control purposes based upon the violation of any order of the State Health Officer. For the purpose of enforcing such orders of the State Health Officer, persons employed by the department as investigators shall have general arrest powers. All law enforcement officers are authorized and directed to assist in the enforcement of such orders of the State Health Officer.
So if you're sick, stay home or you go to jail.
Right, Jester? It's the law, right?
Well, we're glad we agree. He also is pretty excited because he received a very generous donation from the organization. Officer Spicer, would you like to elaborate more about that?
Yes, he received a ballistic stabber's vest that was donated by a sponsor from Holiday, Utah, the Rivera family, and it was through a company called Vested Interest in K9. They're a 501c3 organization that donated this item, and they typically range from about $1,700 to around $2,300, so it's an expensive donation.
So just like you guys wear the vest all day long, he will not have a vest to wear while he's on
He's
the
bulletproof.
That's right. So he's going to have some protection just like any other officer would. And they also, that same organization also provides Narcan kits for canines in case they are accidentally exposed to a opiate that would cause them to overdose. And so that's a very good company and a very good charitable organization that did a fantastic thing for us.
So Officer Spicer is Jester's handler, is that the right
Yes,
term? And we're so happy to have you guys. You're like a dynamic superhero duo. So we got superheroes of every kind. I'll be honest with you, I think Jester's everybody's favorite.
I think so.
Jester's a rock star for sure.
He does a lot more than the police things. Everybody here loves him. There's a lot of these staff members, we have bad days. It's a really stressful time. And they just see him and they get instantly happy.
He's prepared for all the callings.
He does. He provides many services.
And speaking of that, Jester is also, as we said, our relationship that we have with the other law enforcement agencies in the county. Jester is a resource that's available to those other agencies as well. So he's obviously a rock star for us, but he's a resource that we make available to any agency within the county that needs us.
And didn't they also give you something else for
Yes,
if he takes down a drug dealer and swallows some drugs or something?
That's the Narcan. And,
Okay.
That's something that.
Okay.
The same kind of medication that you would give somebody coming into ER that was human.
It's the
Yeah.
same.
Gotta take care of Jester.
Yes. A lot of times people forget about the canine officers, but they're under the same risks. Actually, they go into more dangerous situations than we do.
Well, everybody, we appreciate you tuning in. I am so happy and proud of the police department that we have here, and I'm so appreciative of the efforts of all of our law enforcement, first responders, the firefighters, Earl and his emergency management team, everybody in our community, the constables out there working together, helping to get that education material out. I really think that's had an impact on smashing the code here in Jackson County. So thank you to all of our first responders and our superheroes. We appreciate you all. So stay safe and river strong.